My name is Gabrielle Williams. I've been a nurse for 35 years. I've worked for Nurses for Newborns for 13 years. The most powerful experience I've ever had is making sure that I can meet the needs of the mothers and babies that we have in our care. Each case has its own challenges and reward, but I'd like to think that in the end, I've given each mother and baby what they needed at the time.
I'm Carrie Anna, and I have been a labor and delivery nurse for 30 years. I have worked mainly in the hospital setting. I've also had the privilege of being part of many medical trips to different countries such as Africa, China, Haiti, and Honduras. I started working for Nurses for Newborns 2 years ago, and I feel like Nurses for Newborns provides a very much needed lifeline in the community. I love walking this journey with these precious families, going into their homes, meeting them where they are, providing education, support, resources. There were so many times when I was working in the hospital setting that I would send a new mom an infant home and think, oh my goodness, I wish I could just follow up with them at home. And Nurses for Newborns gives us that opportunity to do that.
Hi, my name is Drew. I've been a nurse for about 13 years and I've been with Nurses for Newborns for about 4. I came from a public health background and a primary care background. I was working as a pediatric nurse practitioner, and one of the things that really drew me to Nurses for Newborns was primary care. I was only able to have about 15 or 20 minutes of interaction with my clients, but Nurses for Newborns allowed me to do much more. Going to the home and seeing how they live and the holistic environment allowed me to really get to know them much better and to have a deeper impact onto their lives. The idea that I can take my time and give education and do the assessments and then dive into what mom is feeling, what's going on with their family, really, again, lets me help the family in much deeper and better ways. One of the most challenging things, I think, is going to homes that have so many things going on, more so than what education and assessment can fix, but doing my best to give resources to them and connect them to others in the community that can assist them. Some of the most rewarding parts of this job are seeing moms be able to understand or to have a breakthrough or to feel better about breastfeeding or about discipline or about being a parent and having confidence and strength to do the best that they can in their situation.
I'm Stanya, nurse specialist. I've been with Nurses for Newborns for 3.5 years. I've been a mom-baby nurse since 2011. When I was 19, I had my first son. I had some late pregnancy, early postpartum complications. The nurse that took care of me, her name was Barb, she left a lasting impression on me. I knew then that I wanted to be like her. I wanted to be there for moms. I wanted to help them during this amazing time during their lives. One of the reasons I love Nurses for Newborns is that we are able to be in the home with the families. We can follow them and work with them until the baby's 2 years old, which is amazing because in the hospital we would see babies for 2 to 4 days and then send them home and just always kind of wonder how they're doing. what they're up to. Now we can kind of become part of that family. We get to watch the babies grow, meet their milestones, and thrive.
Hi, I'm Nancy. I'm a nurse with Nurses for Newborns and been with them now 11 years this month. I spent about 25 years in the field of social work and decided it was time for a change in careers, so I went to nursing school. Graduated in 2003, worked in the NICU, I worked in labor and delivery, and enjoyed my time working on the floors and working with people. But I decided to come to Nurses for Newborns because I really liked the thought of being able to meet the people where they are and to do the kind of parent education that I specifically felt called to do. I like working with pregnant moms that are struggling to help their baby grow as long as possible in utero, and so providing them support and encouragement and nursing assessments on a regular basis definitely helps a mom be a little more comfortable and a little more at ease. So I do enjoy education with pregnant moms. I also enjoy education for families when their baby has special needs. I enjoy working with moms with opioid use disorder and the babies that they give birth to being exposed in utero to those drugs. And I feel like when they're ready, and many of them are once they have a baby in their arms for motivation, are ready to make a change, and our role is to support them and encourage them and help them find treatment that will work for them and their family.